It is 6:03. The pandemic has been especially hard for teenagers.
In addition to going through virtual learning right now, a lot of them have been isolated from their friends literally all summer long. This morning, WMAR2 News' Mark Roper has a look at some changes in your child's behavior and what to look for really and when to be concerned. Good morning, Mark.
Good morning, Christian and Ashley. You know, most kids have gone back to school, but from home, just like many of us are working from home. And the stress and anxiety brought on by the many changes during the pandemic over the last 6 months have some young people more distressed than usual.
Going back to school in 2020 for many kids means most schools are closed and many after-school activities are canceled.
With teens, especially with the disruptions that are happening around us during the pandemic, it's causing more anxiety, more isolation. And one thing that we know is isolation is never a good thing for teenagers, more so during a pandemic.
Shepherd Pratt Outpatient Services Medical Director Dr. Deepak Prabhakar calls recent data from the CDC about young people a pandemic within the pandemic.
1 in 4 individuals between 18 and 24, they are reporting serious thoughts of suicide. About 1 in 4 is also reporting either worsening or initiating new substance use. 3 out of 4 are currently reporting signs of mental health related issues, and 2 out of 3 are actually reporting serious anxiety and depression.
The teenage years can be tough enough, but during COVID-19, they become even more complicated.
When you take these 3 things together, disruption in school schedule, disruption in their social activities, isolation from others, their peer support network, all of these things are leading to higher anxiety and being relatively unsure about what's next.
A change in attitude and a change in behavior may be cries for help.
Total isolation, staying in bed way too long, straight out coming out and saying that they are having thoughts of harming themselves, sometimes in person, sometimes broadcasting these thoughts on social media.
Parents with moody teens may wonder how much moodiness is relatively normal and when should it be a cause for concern.
When we start seeing enduring depression, enduring anxiety, aggression, not just for several hours a day, but several days a week and then several weeks a month, at that point, we probably need to pause and ask ourselves, maybe this is something else that we are observing in front of us.
And it's at that point that Dr. Prabhakar recommends getting professional help or even calling 911 if your teen seems like they might hurt themselves or someone else. And for a list of resources that you can use to help, just look for this story on our website, WMAR2news.com. Mark Roper, WMAR2 News.
Yeah, Mark, that's the important point. Sometimes teens can be a little distant. It's hard to know when there's an actual problem and when it's just teens being teens.
Yeah, and it sounds like the parents, they have to take on that responsibility of really asking them questions and being involved, because it doesn't sound like your teen's going to just share that they need help.
Yeah, Mark, that's one of the things that the doctor talked about there.
Yeah, because especially, you hear the expression, we're all in this together, and we really are, because it's not just the teens. It could be the parents themselves. The parents themselves could be caught up in things where working from home, changes that the parents are dealing with. Maybe a parent has lost their job. But despite all of that, it's still really important for parents to be connected to their kids and have those conversations, to check in on them and just make sure that they are okay and make sure that they are feel free to come to the parents with any stress or problems that they're having.
WMAR2 News' Mark Roper, thanks very much for that. That is just an important issue for so many
the teen years
families.
can be tough already, as Mark said in his package, and then you add this.
And now this. Okay.